pursuant to Chapter 2 of the Acts of 2023 and H 62 as amended by S 2506. This meeting will be conducted via remote means. Members of the public who wish to access the meeting may do so in the following manner. Please see on the agenda the connection information to join the meeting by Zoom video conference or by calling in by phone. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the Topsfield Town website at https://www.topsfield-ma.gov. You may also reach out to the Topsfield Board of Health at health@topsfield-ma.gov or 978-887-1520 for information or assistance. No in-person attendance of members of the public will be permitted, and public participation in any public hearing conducted during this meeting shall be by remote means only. So is Topsfield Cable here yet? Does anybody see them?
Yeah, they're here.
Oh, okay, good. So Topsfield Cable TV will be recording this meeting. Is there anyone else who would like to record the meeting? So hearing none, we'll move along and let's begin with a moment of silence. Thank you. There are no appointments that I know of that are scheduled. Did any pop up in the meantime, John, or still have no appointments? Okay. So that we're up to item number 4, which is meeting minutes, and that is for February 18th, 2026 meeting. I have them in front of me and I've read them and I don't have any edits or questions. Does anybody else have any edits or questions?
I don't have an edit, but I realized that we had talked about the Grow Spring event
Uh-huh.
and that I had said I could possibly do it. So, but I did not get back to John or Sue. I can do 8 to 12 or 8:30 to 12:30. I have something later on, so I can't do it past then. If that's okay.
All right, well, they'll take that under advisement, Ellen. I suppose we can talk about it later in the meeting if John and Sue have had a minute to think about it, but otherwise you should probably just, now that they know that, maybe you can get together with them
Okay.
tomorrow or a different day. But anyway, regarding the minutes, if everything is correct as written, we could entertain a motion.
I'll make a motion to accept the minutes of February 18th.
Yes. Thank you. Is there a second?
I'll second.
Carl seconded. Is there any further discussion on the minutes? Okay, hearing none. All those in favor of accepting the minutes as written, please say aye. I'll do a roll call. So Ellen,
Aye.
Carl,
Aye.
and Bill,
Bye.
and myself, aye. So the minutes are accepted as written unanimously. Thank you very much. The next thing on the agenda is the health director's report. And there are two attachments that you should pull up that relate to this. One is called Working Copy Volume Analysis FY 2025. And that sort of, this is the information that we keep track of and we put it in the annual report. And the second attachment is an email. It was sent in an email from Sue on just this Monday on March 16th. And the email was titled Septic Projects through thus far in 2026. So with those two things in front of you, I'm going to turn it over to John Boulay to give us a little more of a deep dive into all he's been working so diligently and and plans have just been rolling in, and I realize we could use a little more detail on how many plans and what kind of plans. And so John is going to tell us a little bit about that.
Hi everyone. So everything's going well in town. Yeah, we're up to about 28 septic repairs. If you look at that sheet that we've had come in this fiscal year, we've also had about another 8 applications for new septic systems coming into the office. Plan submissions have definitely started to pick up the last couple weeks. We had 3 or 4 coming into the office. One being the 10 School Ave project that I'll touch on in a minute. A couple of homes come in. We've had quite a few residents stopping in the last couple of weeks for questions about adding additions and how that affects their septic and renovation projects. There's one house that is a complete gut that they were asking if can they keep their septic, can they not? And then we've actually had a couple people come in, actually one today, about a question about an ADU possibly going in. So all that's going well. We also had to do a soil testing this month, which was not a typical one. We did soil testing to confirm the high groundwater table for a Title V inspection, which basically could not find enough information in our files to determine where the high groundwater table is. So we did that a couple weeks back. But that actually went well, and the Title V inspection ended up passing once we confirmed that the groundwater was not in the bottom of the leaching area. Um, Other notes, big projects. Just wanted to give an update on all the big projects going on in town. The 10 High Street one, we did receive the check from them this week. Sue got the account set up with the accountant, and we did receive a proposal from Tom Manetta. So that one will be getting worked on for the peer review in the near future. The plans were submitted a couple weeks back for the 10 School Ave project, the restaurant that's going in downtown. Chuck Johnson spent a very large amount of time working on that project. Um, Him and myself have sat down, I would say, at least 3 or 4 times before he submitted the plans, and we sat down for 2 or 3 hours last week to review the plans. After submission, spent a lot of time going over that project with him. The system's very interesting. I think it's well thought out by Chuck. He told me he feels very happy with how the design came out. The system, just to give you some more information, it's very interesting, and there's multiple components. It's a basically 8,000 gallon 2 compartment grease trap that then flows to 2 different septic tanks, another 8,000, and then a 7,500. It then flows to 3 more tanks, which are called biocon tanks. They basically have a type of media inside the tanks, and it uses compressors to blow air throughout the tanks, which helps to lower the BOD and the total dissolved solids. So basically, the effluent, once it gets through those tanks, is going to be very clean. He also is putting in a third one of those biocon tanks to essentially just keep in the ground, not online. And if he's not happy with the effluent that's coming out, he will basically turn that one online to add more secondary treatment. Then after that, it goes to 2 more tanks, which are clarifying tanks, 5,000 gallons apiece. And that's basically the secondary treatment component. It then will travel into a 9,000 gallon pump chamber, which will then be pumped up to a drip dispersal leaching field, which is the tertiary treatment for that project. So like I said, very well thought out, very I would say over constructed. Like I feel very good about the project. I don't think Chuck really has any concern at all. Um, I'm very interested to see what the effluent is like when they do the tests afterwards to find out what the total dissolved solids are at the end of that. I picture the water being basically crystal clear, but we'll see. Other shorter updates, the project at 249 Raleigh Bridge Road for the brewery is nearing completion. The septic system, I believe, is fully installed there. I think they're still waiting to put the liner in for the tank for the brewery discharge. I imagine they're just waiting for the snow to clear, so we'll probably hear from them in the coming weeks on that. I do remember the contractor telling me it has to be dry before they put the liner in, so I imagine that's what they're waiting on. Um, then I'm also working on a plan review right now with Dan Johnson, who submitted it for the Topsfield Fair. They're planning to add another structure on site to basically house quite a few more bathrooms, and to kind of minimize having basically as many porta potties on site for the fair. So I think it's a good idea. I think it's a nice addition to the fair. Other than that, that's pretty much my update.
Thank you, John. That was perfect. Does anybody have any questions for John? You said a lot.
Yeah, sorry.
Very, very succinctly, though.
You had said in the minutes, or there was a report in the minutes about being approached about housing for the World Cup games, and
Oh
was that
yeah, yep.
dispersed with and basically ruled out that the fairground could do it, or it wasn't clear on the
Oh,
So it wasn't really in reference to the fairground. He was just asking for basically comments on if we've ever had any issues with, housing. And I said, well, the fair is really 10 days and, some of the people that work at the fair may stay on site, but a lot of them stay in hotels. It's not really similar to the World Cup, where basically people are, from what I gather, just doing my own research, the World Cup's going to go on for multiple weeks in the Gillette area, and then there's also more games down in New York City. So I don't know if people from other countries are playing to stay for that entire time, but it's kind of not really the same as the fair. And the other concern too that he has is people are going to try to put temporary housing on private property, like in your backyard.
yeah, yeah.
So.
Hmm.
He was just looking for any information I could possibly give him. But I gave him what I could and I asked the fire chief. She didn't really have anything to add, so
Yeah.
yeah. One of those meetings, one of those monthly presentations that DPH gives, they went into a deep, deep dive on preparations for the World Cup. Wow. It's sort of like preparing for the marathon, which I don't know if you've ever heard those, all the planning they do on steroids,
yeah.
because now these people are going to be staying here, crowds of people. It's going to affect housing. It's going to affect septic, even restaurants, be lots more people eating in restaurants. I mean, they just went on and on about all the public health work that was involved to prepare for this, not to mention emergency preparedness, not to mention these people from all different countries having different, possibly bringing in different diseases or having needing vaccinations. I mean, it's massive. They're really doing a lot of preparing.
Hmm. There was just something on the news tonight about somebody in Plainville wants to construct temporary housing for like 1,700 people
For
there.
this, for the World Cup.
Yeah,
Ah,
and they were commenting how it's kind of late. He's only got 3 months before the first
Hmm.
games. So anyway, that's beside the point for Topsfield.
luckily, I don't think they'll be coming out this far to stay, but
Yeah.
yeah, yeah. Well,
Yeah.
any more questions on John's report? Super. John, thank you so much. That really gives a much clearer and vivid idea of all the work that you're doing and that comes through the Board of Health and Sue, because Sue is tracking all these things and the front-facing person when they come into the office and ask for plans and scheduling and things like that. So that is fantastic. Um, so the next item is item 6, which is new business. And under new business, the item is labeled discussion and vote, retain services of Julia Lobel, RN, for 2026 camp inspections. And just to give a little background on that, in Massachusetts, recreational camps for children must be inspected and licensed by the local Board of Health. The Massachusetts state regulations at 105 CMR 430 establish minimum health, safety, sanitary, and housing standards for recreational camps. So in Topsfield, we have 5 camps that need to be well, is 5, I could be wrong. John, is this in Topsfield or is this in the Tri-Town? We have 5
No,
in,
Julia said there's 5 in Topsfield.
she did, okay. So 5, and the inspections need to be done in May, and Julia has estimated it will take her 14 hours to do that work. And so apparently there is money in our professional services line item to pay her. And then I did speak with John earlier today, just to give you a little more background in that so I've been involved in inspecting camps from a nursing point of view, from the medical point of view in the past. And usually you go in tandem with the health inspector to inspect the camps together. And the medical stuff is crucial because it involves reviewing all the vaccine information for all the incoming campers. And that can be complicated if people are coming from other states or even other countries, because they have different vaccine requirements. And that the people coming into the camps have to follow the Massachusetts vaccination requirements. And then also there's medication issues. Kids often come to camp with emergency type medications like inhalers or EpiPens, and they also might need to be given their routine medications in camp, which is a whole nother thing. You have to have licensed people to give these medications, and that's just a glimpse. And then for the actual inspector, they would be inspecting things like docks on the waterfront or adequate facilities, bathroom facilities, structures, structural integrity of buildings. They also need to have extensive plans for emergencies, such as a lost camper, a kid runs away, what's your plan? Or the counselors, who are you employing? Do they have their certifications? And on and on and on. It's a huge amount of work, and it can't be done slapped together. And sometimes new camps are completely are unaware of the massive amount of preparation that they have to do to get certified to run their camp. So it's great that we're thinking ahead for this. And then so what I started to say was the new Tri-Town nurse who has apparently been hired, we don't have any information at all on her training or if she would be ready to do these inspections. So having no information about that, John was very forward-looking to put this on and Julia, to put this on the agenda to make sure that we as a board, approve the plan to retain Julia's services to inspect the camps. So that's my introduction. Did I leave anything out, John? that
Nope,
you,
I think you got it all. But I mean, Julie's done these camps for quite a few years now. I think there's something to be said about knowing the camps, the people that run them, the, facilities, how they're set up, etc. So I think it's a good idea for sure.
thank you. Any questions or comments from anybody on the board for this item?
It seems to me she also did camps in Boxford. Did she do any in Middleton? Or
Yeah,
did they?
I
Yeah,
think so. If there are any, and I think there are in Middleton. Whether or not she does them now is now their problem
right,
because
right.
yeah. So, but we just want her to do these. It's enough to do 5 camps. All she's doing well to only spend 14 hours because it's so much work. But
Mm, yeah. Should the other towns be given a heads up that, they've so used to her doing it, are they gonna remember?
yeah, well, we could. Well, I suppose one would hope. But I mean, Tracy is certainly familiar with that, and so is Kendall, the health agents for Boxford and Middleton. They're very well familiar with camps. It's a routine thing for health departments. If
Okay,
they don't have that on their agenda, then I don't know what to say.
yeah, okay.
But that's a very kind thought.
And these certifications have to be completed before opening day?
Yep, yep. And most of them, yeah. So you try and do them in May. It's tricky because, they're getting some of the bigger camps. I mean, the sleepaway camps up in Maine and everything, those kids are flying very, very early in the season, sending in all their big bucks. But for some of these smaller camps, day camps and stuff, it's a lot of last minute stuff. So it's quite a juggling act to get this stuff that you need, get in there and get everything before the day that the camp is going to open. But yeah, you're right to think about that. And most of them open pretty much when school ends. So that would be
Hmm.
late June.
Yeah,
Yeah, and some of this stuff can be reviewed in advance, like the emergency plans, obviously. They should have that written in advance.
we'd
So
hope.
any more questions?
Would Julie be doing the work for, I guess there's food services and stuff at camp? Or is she just doing the medical reviews?
I think she's just doing the medical stuff. That's why we need another inspector. And John was saying,
John's got to do that.
yeah, or Colin, who was our Tri-Town inspector, and they haven't, the details between how they're going to work together on that have not been worked out yet. But between the two of them, yeah.
Okay, that's
And
all
some
for
of
me.
these, okay, thanks, Carl. A lot of these smaller camps, I mean, the kids might bring their own lunch or not even have lunch or,
Hmm.
might not be any food involved, or there could be. So I don't have I don't even have the list of the camps in front of me that we have. But those are good questions.
Mm.
Um, Anybody else have questions? Okay, so the item is we need to vote on retaining the services of Julia Lobel RN for 2026 camp inspections in Topsfield. Would somebody make a motion to that effect?
A motion to approve the 14 hours to retain Julie for camp inspections.
Is there a second?
I didn't hear the full language.
Motion to approve the 14 hours allocated for Julie Lobel, I think, to conduct the camp inspections.
Second,
And you seconded it. Did I hear a second,
yes,
Ellen?
I did.
Okay. And so discussion, um, I don't know if we should say 14 hours in there.
Yeah, it was
Okay.
one.
I agree with Cheryl. That was my,
Yeah. But
Okay.
that was, so
I
do
agree.
you want to revise your motion, Carl?
Sure.
Okay.
Motion to retain Julie for the camp inspections as required for 2026.
I Very good. Is there a second for that motion? Bill, oh, you seconded,
Ellen
I
might have
did.
had her hand up first.
Ellen?
Yeah, I did.
Okay. Is there further discussion on that motion? Okay. Uh, so does everybody, do I need to read the motion back or does everybody clear? It's motion to retain services of Julia Lobel, RN for the required 2026 camp inspections, I think is what you said, Carl.
Yep.
He used the phrase as needed.
As needed.
Yeah.
I agree. That's fine. Okay, as needed. Okay, that's the motion. Um, thanks for that. All those in favor, uh, say aye. Carl.
Aye.
Okay, Bill,
Aye.
Ellen,
Aye.
and myself, aye. I have to do the roll call because it's a Zoom meeting, Carl. I don't know if you knew that, but it's required by, yeah. Otherwise, we could just raise our hands, but it has to be verbal.
Okay.
Zoom.
And Bill, thank you for coaching me on how to make a motion.
Well, no, I just want to make sure that I think those are the two most important words.
Yeah.
So,
That's needed. Yeah. Yep. Yeah. Thank you. That was very good. All right. Um, Old business, public health excellence update. I attended as a member of the public a meeting of the Public Health Excellence Advisory Board that was held on February 26th via Zoom. During that meeting, Kendall, who was the chairperson, was not able to access the meeting via Zoom for some reason. So Kevin stepped in and chaired the meeting and did a very good job. The only, there was one thing on the agenda of relevance, and that was a health and wellness fair that's scheduled for April 11th to be held at Masconomet High School in the cafeteria, I think. And that was we did not have any advance communication about that in Topsfield. And as far as I know, there hasn't been any further communication about it to announce it. So we don't know what participation would be required of Topsfield or how exactly that's going to work. We have no details. However, John reported to me today that Jessica Carter will be coming in, I believe, later this week. Correct me if I'm wrong, John, to talk about it. Is that-
Monday.
Monday. So it'll be next week.
Yep.
Okay. Uh, and that was it.
Do we know anything about the purpose of this health and wellness fair?
We do not.
Okay.
I'm refraining from editorializing here because I've been, of course, involved in health and wellness fairs myself in the past, and they're a lot of work. And knowing what the purpose is and the goals is an important question.
Yeah.
Yeah. So we'll more to come about that, I guess. And then, okay, the opioid settlements. So, oops. We're gonna give-
Well, I can report on that.
Oh,
me-
good.
Well, the meeting was again postponed, so
Which meeting?
the
Well,
opioid meeting.
Yeah, what was the date
It was
for?
supposed to be March 5th, and that had been postponed from a February date. And now that's it's been on Thursdays, but there's been a request for a Monday. So it is going to be this Monday, the 23rd at 10:30, I believe. Did you get that notice, John?
I didn't get the official email yet. I can let you know though.
Okay.
Okay. Well, that's great. So Julia was I thought Julia would be here to give an update, but Julia did send in a report, which I want to walk us through in the absence of Julia. because it's a big topic. And relevant to this topic is one of the correspondences that we received, which was the very last thing under correspondence, DPH notification, launch of opioid settlement funds dashboard. So that was that was emailed to us by Sue on so it was dated March 11th on the attachment. And so Sue sent it out, and this is launch of a public-facing dashboard that will allow users to track how opioid settlement funds are received, allocated, and spent across Massachusetts. The big picture of this is for any people not following it, because it can get confusing. In this email, it says Massachusetts is expected to receive $1 billion over 18 years as part of sweeping nationwide settlements with pharmaceutical companies, distributors, and retailers related to allegations brought against them in connection with the opioid overdose crisis. And the new dashboard allows the public to explore settlement funding by fiscal year, both the state's share and the local portion, which comes under municipal opioid abatement funds. Yeah. And so then Julia sent an attachment which was sent to you guys on Monday, this past Monday, March 16th. And the date on that she did the report was March 4th, and the title was General Update for March 5th Meeting. So this was, okay, so this was the report that she had intended to give to the
Right.
March 5th opioid meeting that was postponed.
Right.
And the first thing, when you look on the first page of this, there's a chart, and it's called Estimated Annual Payments. And if you look on the left-hand column, there are dates that go from 2023 down to 2039. So these monies are going to be dribbling in over that span of time to each and every town in Massachusetts and to the state. And then the different columns are showing where the different sources of this money that will be sent in, such as Walmart, CVS, Walgreens, etc. And then the last column is showing and this report is for Topsfield. You can see in tiny letters at the bottom of the chart, it says Topsfield. So the last column is sort of a running, well, how much was received each year. So if you look, the first four numbers is how much we would have received through 2026. And if you add them up, it's around $99,000. And if you look at the last number in the last column, it's $268,000. That is what Topsfield is predicted to receive in total by 2039. So far, does anybody have any comments? Did I make any mistakes? Because I just kind of looked at this today. All right, so, and then she's further down on the page, she's saying recent board of substance abuse data from July 25th indicates almost a 40% decrease in opioid-related overdose deaths, which is the sharpest decline since 2013. I'm not sure if she's referring to state or nation, but the very, very last page of the report gives fatal drug overdose data in the United States. And you can see that in 2021, it was 51,000, and then 2023 was 75,000. And so far in this is Joel 2025, the preliminary data says 23,000. So
January to June.
January to June, they only have, half a year.
Yeah.
So that's, this is what Julia wrote. I can't, back it up. But, so then the rest of the report, she's talking about what expenses have been approved and what is happening with those projects. So you can see on the left-hand column, $2,000, it starts with youth mental health, first aid. And then Julia is saying what she has done so far, what has been done regarding each project. And it goes on the same format for the second page. And at the bottom of the second page, you can see that $1,200 approximately was allocated for an opioid outreach nurse to work 0.5 hours a week. And that is Julia. Julia is the opioid outreach nurse. And basically what she's doing is coordinating all of this stuff on an ongoing basis and reporting back. And so, you see in the newspapers articles that say, oh, the towns have received all this opioid money, but they're not spending it. Well, here's the details of what do you mean they're not spending it? For instance, on the second page, the second line, it talks about $10,000 has been allocated for a website design, but it's on hold. 2,000 for direct mailing to promote the website is on hold because we don't have the website yet. And then the next to the last line, Narcan training for the community, $1,500. It's on hold. So these are just some details about what's happening about spending the money. And then the third page talks about new requests. So Topsfield Vocational Academy asked for 2565 for vape detectors, and then they asked for CPR and naloxone training, and also Tri-Town Council has asked for that, and of course that's pending. So that's sort of like the summary of the money as it relates to Topsfield. Then when you go to the third page of Julia's report, it starts talking about the community profile. And so the first page is for Massachusetts, and you've got 3 columns: substance-related deaths, the first one; the second column, substance-related emergency events; and then third column, substance-related community care is what it means. So there were about, and then this data is for the year 2024, and there were, going back to the first column, over 7,000 substance-related deaths, but they have a firm number for opioid-related overdose deaths, or 1,336. And it takes time to compile this data because sometimes it's a delay. There's a delay in deciding what is the main cause of death, and the reports are delayed. And if you've ever looked at statistics, you don't always have them.
Yeah.
And okay, so that is for Massachusetts. Then when you come to the next page, it's for the top 3 charts is for Essex County, and then finally we get to the bottom 3 charts, which is for Topsfield. So the first column indicates in 2024 there were no substance-related deaths for Topsfield. However, the second column indicates there were 42 substance-related emergency room visits and 30 alcohol-related emergency room visits. And and that's that. And then for the third column, it indicates that it looks like there's nobody on methadone, but 17 people were received prescriptions for buprenorphine, which is the thing that prevents you from getting it a high off of opioids, so you don't want to take them. And then that's it. So I don't know. I this is my attempt to explain Julia's report. Is there anything that anybody would like to discuss?
Does the distribution of funds have a prescription on how they should be just used in the community?
That's a great question. So that was what I skipped in the beginning of my explanation. Yes, it there was information sent out in the beginning telling us what the restrictions were, but there was more than just a restriction. There was a mandate that it had to be community input had to be um, the main consideration in how to spend the funds. So at the beginning, I mean, the towns had to organize committees and invite all the people to be on them. And the committee in Topsfield, and Ellen, you might want to say more about this, but the committee in Topsfield is widely represented. There's Tri-Town Council, the schools are represented, churches, the police chief, the fire chief, the Board of Health, and then other agencies like senior agencies and
Yeah,
any agency you can think of. So go ahead, Ellen. Did you want to add to that?
I was agreeing with you on the Council on Aging.
Council.
I'm trying to remember her name. She's right in Town Hall, and I can't remember her name.
Yeah.
Anyway, yeah, she's at the meetings. John's been at the meetings. So
So
it's been, I think it's pretty widely utilized. Coming up with, the actual spending of the money is, we've had some meetings where we've said, okay, we need to decide what we're going, because there've been a lot of presentations of things to spend the money on, programs, et cetera. And so the last couple of meetings have been on, okay, so let's spend this money. Do we want to do this? And kind of starting to really activate what the need is and how it's going to be dispersed, how the funds will be dispersed. So some of the things on hold, I hadn't seen this, until Sue sent it out, so I wasn't aware of, the extent of that. This is a new position for Julia. She's just, like, it was probably December or November that she was asked by Kevin to do that position. So, and in Julia fashion, she's doing a great job. Obviously, I think it's very comprehensive what she's done. So,
yeah, somebody has to follow up on all this stuff, and the devil's in the details and the phone calls and how are you doing? What do you need? And what's the holdup? And what can we do next? And like, how can we move this along?
yes,
Yeah, the reason I asked is, current balance is sitting at 90,000, expenses paid are 8,800, and that means we're not leveraging this asset for the community's benefit. And if we're waiting for the community to help give us guidance, that makes sense.
Yeah, well, all the things that are on hold, that's why it hasn't been spent. And then she's giving the reasons for for why that money, a big chunk of change, $10,000 for a website. The website is on hold. There's 10,000 of it.
because it's in development.
It's in
I-
development. Yeah.
That was last fall. That was a new, let's do a website, specifically, and then you get into, well, should we do you know, a website on its own? Should we combine with, I mean, the school has a website, the Tones have a website, so just working out those details. And it's a lot when you get into the details of it.
No, I can imagine. I guess my only other question is, are we obligated to spend this money over some time period? Or do we have time to allow the community to give us guidance?
I think there is time. I think that probably been one of the difficulties, that there was no timeline. So uh, we didn't have to keep to a timeline. Sometimes it's nothing better than to have deadlines, um, even though they drive us crazy. Um, so I think that, now, and there's a lot of people on this committee making the decisions, so it probably needs to become a little more refined in how to, who's going to make the decisions, et cetera. I mean, and plus, between the weather and the meetings being postponed, that's been, um, I think, an issue of late. Why nothing has moved. It appears like nothing has moved, but some of those decisions were just made that Julia is writing about. And we haven't really had, um, the meetings to really carry it out.
Yeah, I guess the last one, I guess, is in the Board of Health. What's our role and responsibility here? Is this to monitor or is it to execute or what?
I believe it's just to participate. Other,
Okay.
it's really Kevin's role to make it all happen. Um, that's a good question though, because in many towns, the board of the town administrators or have or the select people, whoever, have appointed boards of health to be in charge of this and make it happen. That's not the case in Topsfield. We are, as far as I understand, a participant in this, the same as everybody else. But when I first started going to the meetings, this was after Wendy left. And so Jerry and I were going, and then Julia came along and Julia was going. Julia was the person who, with the most ideas, who was the most vocal about them and the most specific ideas and plans. And it was frustrating, I think, for her because she would take some of this and come up with all these ideas and flesh them out, and they'd be very specific. And then people would say, "Well, that's a good idea. Let's get some more input."
Yeah,
And
yeah.
so now that she's been appointed outreach person, I think a lot of this will start to actually happen. Um, I don't know why people could be so hesitant to simply spend this money on a reasonable idea or plan, but it's typical committee behavior.
Well, and it's also not that people are hesitant, it's making the decision because there were so many presentations, and all these programs sounded good.
Hmm.
But, then you have to say, rein it in and say, okay, what are we going to focus on? So I think that's what's happening now, and hopefully this next meeting will be well attended, and we can, come to. I have not had a lot of input. I'm there kind of observing more than being one of the leaders, because I don't have a lot of knowledge in terms of this. I have ideas, but not a lot of background in opioids, as a lot of these people. They're dealing with the students, they're dealing with,
Hmm.
the police is dealing, the fire, they're dealing with it. So I'm learning a lot at this point. I've probably been attending for about a year.
Yeah, and before that, before you started attending, we spent a lot of time trying to grapple with what is the problem in Topsfield because a lot of this, well, most of it, the details are confidential, so nobody can come right out and say and tell a story of who's involved, what is actually happening. It's all confidential unless people want to come forward,
Mhm.
which some people have. And
Mm.
so you, um, you're getting the sense that yes, there is an opioid problem in every community. Just because, and just because there are no deaths doesn't mean there's no problem. And I remember the police chief told me a while back, he was so frustrated because in previous years, before all this money became available with the opioid settlement, there have been grants for substance abuse prevention, and he would apply for them, and he would be told, "Well, you don't have any opioid deaths, so there's no problem there in Topsfield, so we're not going to give you any money."
Yikes.
Yeah.
So
So we have to wait till there's a death?
exactly.
Yeah, yeah,
So we spent a good chunk of time just grappling with the problem and sort of interviewing all these different agencies that touch upon it. And you find out, oh yes, we deal with this all the time, and they have to speak in circumspect language to so as not to reveal, confidential information. But they've all assured us this problem affects pretty much all of society everywhere. So,
yes,
because don't forget, I mean, a one of the problems was the overprescription of the opioids to just the ordinary person who had surgery, and we're given a prescription for an enormous supply of opioids and not necessarily told you don't. Some people have thought, oh, the doctor wants me to take these pills
yeah,
Yeah. It's like
every
my
4 hours.
antibiotics. I got to take them till they're done.
Got to take it. He prescribed it, and so that you run into even the simplest problem like that
yeah,
that it can affect anybody,
that's right.
and on it goes.
But I
So
don't think today that's our major issue. Do you?
say that again.
I don't think today that's the major issue. I think that the prescribers are a lot more careful about what they're
Yes,
prescribing and how
yes,
how you get a refill and
yeah, yeah, and that could be even the main reason why the numbers are coming down a little bit.
mm-hmm,
So yeah, it's a huge issue.
sure is.
Any further discussion?
No,
Okay. Thank you to Julia for the report. Thank you, Ellen, for attending the meetings that hopefully will happen
yeah,
more than not happen.
yeah, I know.
Um, and let's see, the bills paid. Well, this is much more straightforward. Um, mm, mm, mm. So we paid. Okay. We paid for $850 out of the opioid supplies on, I believe this was for, actually, I don't know what it was for, Sue. Was this the magnets or was this, it was magnets. So there are magnets that cling to metal surfaces that will tell you what to do in an overdose. And Julia was responsible for getting that information together, getting the magnets and distributing them widely. And then we spent $142 on other opioid supplies. That was also from the opioid funds. So that's not our budget. That's the opioid money that we just talked about. $88 for field supplies from Staples, $360 for picking up dead animals, which is important. $21 reimbursing John for mileage. And $50 to have sharps picked up. We share that expense with the fire department. This is half of the expense. The fire department pays the other half. And then for revenue was $1,820 coming in. That all goes into the general fund. All of it was septic related except for $100, half of which was for inspecting a residential kitchen and half was spent on was received for a tanning permit. Any questions on the bills paid or the revenue?
Well,
Okay, and then that's it. And then the correspondence, I just wanted to mention the two other things that were listed other than opioid correspondence. One was the Mass Municipal Association was hosting a second webinar about SAPHE 2.0, which is the Excellence Grant. But that webinar was specifically targeted to select people and town administrators, town managers. I sent that to Kevin. I don't know if any of them watched it, but I believe the one before that, the first webinar was recorded and it can be watched. And I'm assuming they recorded this one and we could watch it. This, in my opinion, they should have done more of this in the beginning of the grant because the town administrators didn't really understand a lot about the grant. So now they're going back and explaining it to them. And speaking of the grant, the email communication that came out on February 23rd about the workforce standards survey. I don't know if we sent this out to the board, but I meant to, and I will if it hasn't been sent. But as part of this SAPHE 2.0, there are reporting requirements that the state has to report back to the state legislature on. And one of the things that they promised to do with all this money ultimately was to raise workforce standards and have people who are trained and capable and not just working as staff members, but as Board of Health members. So in this memo dated February 23rd, towards the bottom, it says the survey is for everyone who works in and supports local public health. And the last words of that sentence are including boards of health. And the deadline for completing this survey is April 10th. I did the survey and it was easy. It only took me about 15 minutes. I do think I sent an email
you
about it.
did.
I remember seeing it and realizing I don't have anything to qualify.
It doesn't matter. No,
No.
they're even asking you in there, do you have any education beyond high school? I mean, really,
Yeah.
what
Okay.
okay.
I'll pass that one.
Well, see, we all qualify. But yeah, they just want to know who's on your boards and et cetera.
Yeah.
So,
Okay.
and that's how they get their data and to show how the money is being used and that we have qualified people. But the
Because
other,
it's easier to ask a question than look
yeah,
it up.
say that
This is
again.
the lawyer in me talking, where you say to people all the time, look it up.
Look it up. Oh,
Instead of being lazy, look it up. Like they could look up on the town website who the board members are.
well, they could, but they wouldn't know our credentials.
Yeah,
I had a lot of, excuse me, but Ellen and I have some really major credentials. We
I
put
know, I know.
You did. I'm not in public health.
Well, they didn't ask much about public health actually, but part of those credentials, they do want board members to take NIMS 700 and ICS 100. NIMS means National, oh boy. ICS is National Incident Management System. That's what NIMS stands for. So that's the first one that you take. And it means that we all need to be speaking the same language when there's an incident. Um, and we and it takes 1 hour to do this little thing and do the quiz and then save your certificate so that you can prove to people that you took it and passed it. And then ICS 100 is the basis of Incident Command System, which is the nuts and bolts of how do we all speak the same language? There is an incident command system, and it's kind of like the Army. It's top down, and everybody has a specific person to report to, and you don't go doing things outside of your reporting group and running off to do other things that or just what you feel like doing when there's an emergency. It should be very structured and clear. And there's tons more emergency preparedness training um, where that came from. But uh, I think maybe as follow-up, we should send out just the links to NIMS 700 and ICS 100, just so that everybody can be sure to take them.
Mm-hmm.
You do it online, it's free. Um, take a little quiz, they give you a certificate, and then you're done. I was going to say one more thing about, oh, there was a drill that comes out periodically it's called Web EOC. This goes along with emergency preparedness. What that means is web-based emergency operations center. So this is something that all boards of health are linked into. And this is how we would communicate in an actual emergency. The website is clunky. It is not user-friendly. And so we do drills periodically to make sure we remember how to use this website. And often we fail the drills because it is that clunky. So in our web EOC, they want to know who are the contacts. So John is the first primary contact. I'm the secondary contact, and Sue is now secondary contact because something they explained in the latest drill is you can have an unlimited number of secondary contacts. So someday, perhaps we'll put the whole Board of Health on there as secondary contacts because really, and it seems so simple, but in an emergency, you want up-to-date phone numbers. So they have to do this drill like 4 times a year. We have to do it. And the first challenge is to actually get into the site, remember the password, and follow the directions, which are not easy. So I did the drill. We still are not going to get credit for it because I did it like 1 hour too late. There's always next time. But I made Sue a contact. Anybody else who wants to be a secondary contact, I'll put you in. That's just one tiny segment of emergency preparedness and how it relates to local public health. So that is all I have. Anybody else have anything else? Or no?
I don't think so. Let me look. There was a question related to the opioid meeting about Julia being also at the Grove Spring event. So we don't know whether she's going to be there or not for the
Right.
opioid committee.
Yeah, I don't have any more information. John, do you have any more information?
I don't know.
No.
Okay.
So, yeah, so that's something to follow up on, I guess, Ellen.
Well, I'm assuming I'll see her on Monday, so
Oh, that's right.
yeah,
Let's hope that. Oh, wait, is that the opioid meeting on Monday?
10:30, yeah.
Okay, so I'm planning to come to that too because we have a new minister in our church and she's replacing Martin, who was on the committee. All the town religious leaders are on it or invited to it, and so I was going to go and bring her with me and introduce her to the group.
Oh, good.
Yeah. So we'll all see Julia on Monday, hopefully. That'll be good. All right.
Good. Sounds good.
So hearing anything else? Okay. Motion to adjourn.
I'll make a motion to adjourn.
Second,
Meeting of March 18th.
very good. Second,
Second.
all those in favor, Ellen,
Aye.
Carl,
Aye.
Bill,
Aye.
myself, aye. Meeting is adjourned at 7:35 PM.
Okay.